reduce SHA claims processing stages and resolve all claims within 14 days from invoice claim date. On SHA payments, Kenya shillings 2.18 billion paid for faith-based organization claims for the period October to December 2024, approximately 50% of all claims made for that period. Most of the remaining claims are held in the other stages mentioned above, especially under clinical review. The current quarter claims are being paid at approximately 48% based on sample data of January and February 2025. We have collected data for 217 KCCB facilities, and this has actually directed our view on this. We recommend that we add key staff to address the clinical review stage and or resolve all cases under this stage within the recommended 14 days.
Unable to get adequate help from SHA regional offices. They seem not to have been trained or empowered to make any decisions. They always refer all questions and support requests to the system developer, who appears to be outside of SHA, unreachable and with all authority. This is collaborated by the media reports quoting the government auditor general that the vendor of 104 billion digital superhighway owns the system, the data, the reports, and makes far-reaching decisions. We recommend that SHA staff should be empowered with the necessary capacity and access to manage the SHA system for efficient services to clients and service providers. Reconciliation. SHA system has no reconciliation function for claims inherited from November 2023 to September 2024. We recommend that SHA to provide a transparent portal dashboard for invoice tracking that can be downloaded for review by hospitals. NHIF had good reconciliation reports. Provide access to that portal to resolve this portion of transition reconciliations. PHS and ECIF. The national budget allocated 4 billion PHC in July 2024 against projection of Kenya shilling 61 billion and 107 billion for ECCIF. Primary health care is virtually collapsing in levels 2 and 3 and some level 4 facilities that opted to offer services due to lack of capitation funds. The quarter of the January to March 2025 has not been paid to date, while capitation is expected to be paid upfront. Recommendation: Parliament to make adequate budgetary provisions and address primary health care cash needs promptly. SHA to roll out a workable PHC services payment system, but in the interim, use the old capitation model that was simple, predictable, and enhanced patient follow-up as they selected a facility every quarter. Parliament should increase ECCIF funds allocated and gazette appropriate ECCIF tariffs on priority basis. Thank you.
We own health facilities. I'm also the vice chair of the Catholic Conference, Kenya Catholic Conference of Bishops. I'm also the vice chair. I've also been around for a while. And, we feel hurt, and it's painful that the very people we defend the poor, we have to make this unfortunate decision that we can turn them away. And it's simply because we are not able. It's like a mother abandoning a child. We are not able to absorb any more debts. We are saturated. We have reached the saturation point in this matter that we cannot creditors are at our doors asking for money. Our workers are there. And it has become a very painful experience for us. And so my one conclusion is that, okay, whatever system the government has put in place in SHA, SHIF, and the others, it's a government business. And our appeal, what we are seeing is that the government is not either willing to pay us for whatever reasons and put on these lengthy, I called it structured delaying process of endless checking and counter-checking and then stopping and all that. To me, that seems to be a way of delaying or even refusing to pay our claims. Finally, to me is that if the government has no money, let them tell us we have no money, and tell the Kenyans we have no money, and call a spade, we don't have money. Dear Kenyans, pay out of your pocket and save us the agony. Because as we talk, as faith-based, as Bishop Langat has put it, we just use the money raised from the fees or the medical bills. That's what we use. We no longer get help from outside. We have to manage that very economically. And, that's where we are. So when we put this across, it's a very painful process, but that's where we are. Challenging the government to come up front, say, fellow Kenyans, we have no money. And handle it. Number two, tell us why these breaks are there in the system, and we'll understand. So that would be my take on this, because it has taken us a very long, painful time. We've met who can be met in this country. And I mean who can be met. We've met the CSEs over the time as these dates were accumulating. And, we have all been treated to this. We are going to pay you ABCD, time goes on, and I think now we've been understanding, and we have come to this decision. Let the government come out and clear it in 21 days. As it has been put, we still continue offering services to our clients, very painfully turning away others. But what do we do when we have to pay our debts? We have to keep important facilities like the dialysis systems going, and very expensive per patient, and making sure that, we don't put them to risk. So that's where we are. And I want to thank you, media houses. You have been with us in the fight. I want to salute you and say thank you. That you are putting the pressure, you can see what is going on. And this has been consistent, even as late as today. I looked at the front page of the Standard. I don't want to repeat what was there. I also looked at the Nation, what was there. And that is it. We are saying, there is something serious wrong in the system. And thank you for standing with us, because we are fighting for the same wananchi. Thank you very much, and be blessed.